I tore my ACL 9 months before I got married, and I was very nervous about that and hesitant to have surgery. And I didn't even know if I would go through with it right away. But Dr. Rui assured me that I would be very ready to dance at my wedding 9 months later. That made me feel a lot better. So I think I started physical therapy about 3 to 4 weeks prior to having surgery. And I think that really helped just keep me mobile, actually, because I think if I hadn't worked my knee, it would have been harder to get back to my full mobility afterwards. So I just kind of showed up, and I didn't have to be responsible for communicating my care, which really helped because I don't know that much about orthopedics. So it was really nice. I think I was only on crutches for maybe 3 or 4 weeks. I healed really well. I was able to get back to all of my activities that I did beforehand and more, and it was a very smoothly run operation, like from being seen into the urgent care to surgery to physical therapy was all done under the same roof, and there was great continuity of care, and I didn't have to be responsible for transferring information. It was all just done for me, all I did was make appointments and showed up, and it was great. The wedding went very smoothly, and I was able to dance all night, so it was perfect.